CPT RVA, page 254, exercise 49, and this is a level 1 exercise, and it reads like this.
Surgery, respiratory. Patient has recurrent spontaneous pneumothorax, which has resulted in a chemical pleurodesis by thoracoscopy.
Okay, it's a surgery section of the CPT book and the respiratory system. The patient has recurrent spontaneous pneumothorax, which has resulted in a chemical pleurodesis by thoracoscopy. Okay, so that's the problem, and then we're going to count to 3, so you can pause the video and give us the CPT code for this. Okay, 1, 2, 3. All right, the answer is 32650. Okay, you got that? 32650. If you got that, then congratulations, you can go to the next video. If you didn't get it, let's give you a tip. The tip is?
Start with thoracoscopy, surgical. We are doing procedures, not diagnosis.
Diagnoses.
Diagnosis.
So ignore.
So ignore pneumothorax.
Right. Don't go to pneumothorax because that's a diagnosis. That's what happens to the patient. But what we're interested in is what are we going to do? What's the procedure that we're going to do, which is a thoracoscopy, right? Okay. So with this tip, you should be able to get the answer. Now you know the answer already. It's 32650, but we need you to get the path to the answer. How you get to the answer, okay? So we're going to count to 3, so you can pause the video and then give us the path to the answer. 1, 2, 3. All right, this is the summary of the whole problem. It's a surgery section of the CPT code, the respiratory system. The patient has recurrent spontaneous pneumothorax, which has resulted in a chemical pleurodesis by thoracoscopy. There's only one code, and the code 1 through the index is found like this.
First, you go to index.
Go to the index.
Then you go to thoracoscopy.
You start with thoracoscopy.
Then you go to surgical.
Surgical.
Then you go with pleurodesis.
With pleurodesis. And you get what? What's the code?
32650.
32650, right? So we're going to check this code in the tabular, okay? So the code 1 through the tabular is checked like this.
First you go to tabular.
Go to a tabular.
Then you go to 32650.
You go to the number that they gave you, and what is that?
Thoracoscopy, surgical, with pleurodesis.
Pleurodesis, and in parentheses, for example, it says?
Chemical.
Chemical, which is the other keyword that we have in the problem. So this is exactly the answer, right? That's why we have the equal sign, which means that we have a double check the answer. So the answer is 32650. Okay? Thanks for watching. Please visit our website. Thank you.